Yeah, so MRD really just refers to any measurable disease that's below the level of detection of a microscope. And we can use different assays to figure that out. We can use flow cytometry, we can use molecular methods, and there's a bunch of different types of molecular methods. In the Quantum First study, what we used was a hybrid of PCR and next generation sequencing to give a limited number of cycles of PCR to just amplify enough DNA that we could then sequence the products and use that to quantify how much FLT3-ITD burden was present. What's unique about that in the FLT3-ITD mutation is that the sequence of the FLT3-ITD is unique amongst each patient and becomes basically like a fingerprint for that patient's leukemia. And that's different than most mutations in AML, that you really can't get that level of sensitivity with that kind of an assay. But for FLT3-ITD, it's a very good way to look for really low burden of disease. Now, other methods have been used variably, such as flow cytometry. The challenge is they're very operator dependent, and so the field is trying to move more and more towards molecular measures to see, how to best treat patients. And the critical role for that largely is that it can help you make a determination of whether your patient's at undue risk of relapse. And hopefully, if you were trying to decide transplant, no transplant, keep with current therapy, change to another therapy, you can say this patient's responding optimally or suboptimally based on that result.